Now, Kerala reported the first COVID case in India in January 2020, and today it's set to receive the first set of COVID vaccination doses. While it was the government hospitals at the forefront of dealing with the pandemic from the beginning, eventually some private hospitals were also allowed to treat COVID patients. Sneha Koshy speaks to some of these doctors and nurses from the private hospital on their challenges as well as expectations as health workers are set to get the vaccination doses.
Well, it seems to be a countdown for the vaccinations, for getting the vaccinations of the health workers, the medical practitioners who will be the first set to get it. Joining us right now is Dr. Raj Lakshmi. We are coming to you from Kim's Health. This is one of the private hospitals where the dry run for the vaccinations happened in Kerala. Now, in Kerala, largely it has been the government hospitals that have been at the forefront at it. Right from the beginning, but it was somewhere mid in the year when private hospitals were also allowed to take in patients. Let's just get a sense of what has it been for them and what are their expectations.
So the initial days were full of panic, as you said, as you can imagine. Our own healthcare workers were affected, and many were in hostel. So it was like an outbreak because the isolation is very difficult in a hostel situation. If you have home, yes, you can isolate yourself. So we had a huge challenge of converting one of the hostel to a isolation center, right, a quarantine center, and you had to pick and choose those who are clearly out of infection or quarantine to work. So our workforce was largely affected. So they were depressed because they were away from home. We had to counsel not only the affected healthcare worker or those in quarantine, but also their family. And by the time we had a good contact tracing team as well as a counseling team who can give phone calls and update and whether they need tests and how their health are.
One, there's relief that vaccination is just days away till you get it. But there's also this whole thing about Covishield versus Covaxin. As a doctor, how do you look at this?
Covishield, we gather all the data from the Oxford Zeneca and then Astra and Oxford vaccine, but then we are extrapolating all those data to our own population. We don't have phase 3 good studies from our own population. But if government has released or granted emergency use authorization and for Covaxin as a part of trial when they roll out in public, we have to wait and watch. We have to watch how that is taken by the public, because it should not affect the public morale and their faith. I can say what I would take, because based on the efficacy study and the phase 3 trial that we have, probably I would prefer for what we have evidence for so far. But then when
that would be Covishield.
So we did also a study in our own healthcare worker. We did a survey to
right,
know their knowledge, attitude, and how they feel about this vaccine.
Okay.
So a good number, they feel that they have no clarity about which vaccine to choose. So probably the government has to come with more clear-cut advice, as well as safety concerns should be addressed before the release, because around 50% they have raised efficacy and safety concern.
So we are happy for that, and because since we are in the COVID line barriers, we feel very difficult to look after our parents and our elderly parents or small children. So we are all apprehensive about their health as well. I am living with my husband, my father-in-law, and my son. And my father-in-law is 82 years old, so I am always anxious about his health, because after we look after our COVID patients, once we go back to home, we will always have to keep a distance with them.
Right. Tell me, Akhil, what has it been with you? What are your thoughts now?
Actually, initially, it is very difficult to cope with the pandemic situation, because in the initial situation, many of them are isolated themselves into the separate rooms. Myself, actually, I stayed in hostel because I have one child this 1 year. So I have the fearing that there is a chance of getting infection to my family and child also. So I tried to separate them, and I stayed in hostel also.